Intramuscular injections are given into the muscle. They are indicated when large doses of medication are to be given or viscid medications are to be given. Intramuscular injections are most often given with 20 to 23 gauge, 1 to 3 inch needles at a 90-degree angle. There are exceptions when performing deltoid injections on elderly patients with little muscle mass or very small adults. In those cases, you will probably only use a 25 gauge, 5/8 inch needle. Common sites used for IM injections include the deltoid, gluteus medius, ventrogluteal muscle, and vastus lateralis. MA tip: never insert more than 3 cc's into one site when performing an intramuscular injection in the gluteal or thigh muscle. Enter the exam room with the prepared syringe and greet the patient. Check the patient's chart for allergies, then explain the procedure and purpose of the medication. Wash your hands and put on gloves. Locate an injection site and assist your patient into a comfortable position. Use an antiseptic swab to clean the skin at the site. Allow the area to air dry. Remove the cap from the needle. Ask the patient to relax the muscle that is being injected so that it will be less painful. Relaxing the muscle will also allow the muscle to accept the medication more easily. Hold the skin taut by stretching the skin between your thumb and first finger. Position the syringe like you are holding a dart in your dominant hand and position the needle close to the patient's skin. Insert the needle quickly and firmly at a 90-degree angle, then release the skin. The dominant hand should continue holding the syringe, and the non-dominant hand that was holding the skin taut should now grasp the back of the plunger. Pull back on the plunger to be sure the needle is not in a blood vessel. If no blood appears, slowly inject the medication. Quickly withdraw the needle while applying gentle pressure to the skin above the needle with a cotton ball or antiseptic swab. Slide the safety sheath over the needle and discard the syringe and needle into the sharps container. Unless contraindicated, gently massage the site to stimulate circulation and improve the drug's distribution and absorption. Apply an adhesive bandage if necessary. Remove your gloves and wash your hands. Hand the patient an information sheet. Document the procedure. Ask the patient to wait the appropriate amount of time and recheck the patient. Check for any signs of a local or systemic reaction. Notify the doctor right away of any concerns. MA tip: you should not inject any more than 1 to 2 cc's of medication into the deltoid depending on the size of the patient's muscle.